Good afternoon, and welcome to the 6th Annual Community Engagement Poster Session. My name is Christine Zeller, and I'm a Program Manager with the MCW Office of Community Engagement. We are delighted for you to join us today. Please note that this event is being recorded, and we will make the recordings available to you within a week or two following our session. To our audience members, please make sure you are muted and off camera at all times. In a few moments, we will hear from Dr. Saeed Ahmed for the official welcome to our event. Then at around 3:10, we will move to the breakout rooms for the individual poster presentations. We've prepared for you to be sent automatically to the breakout room of your choice, but if there is a delay or a mix-up, we will appreciate your understanding as we work to get everyone situated. If you did not submit a pre-selection, you will be randomly assigned a room, but you will have the option of changing your room. Just look for the breakout room selection option in the lower right of your screen once you are sent to the breakouts. At approximately 4:20 or 4:25, we invite you to return to the main room where Dr. Ahmed will provide a brief closeout of our event. I want to extend many thanks to our volunteers who have so generously and graciously stepped forth to help us out with this event in an awesome spirit of collaboration. We couldn't do it without you. Jennifer Brown from the Office of Research, Mandy Kastner from the Department of Medicine, Ashley Sanchez from the Office of Research, Carrie Stock from Communications and Brand Strategy, and Sally Valit, Center for Disease Prevention Research. And thank you very much to our moderators, Dr. Jay Cameron from UW Whitewater, Dr. Kajwa Lor from MCW School of Pharmacy, Dr. Rebecca Lund from MCW Department of Family and Community Medicine, and Dr. Amy Praneski, MCW Central Wisconsin, Dr. Leslie Ruffalo, MCW Department of Family and Community Medicine, and Dr. Christopher Simmons from Marquette University. Thank you. Special thanks also to Kelsey Heindel and Erica Pedersen for all your behind the scenes help. Thanks to the many presenters who are lined up to share their exciting and important work in community engagement. And of course, thank you as well to our audience for joining us today. At this time, I would like to introduce Dr. Saeed Ahmed, Associate Provost and Senior Associate Dean for Community Engagement at MCW.
Thank you, Christine. Again, welcome to the 6th Annual Community Engagement Poster Session at the Medical College of Wisconsin. We are unable to gather in person during this unprecedented time, but we are excited to try something new, create something very differently by virtual poster session. I hope this new platform provides an opportunity to explore and look at the traditional poster session through a new lens. As COVID-19 is in our mind, we need to speak a little bit about COVID-19. As we speak, there's an alarming number of cases all over Wisconsin and also nationally. Medical College of Wisconsin and Community Engagement have been involved providing different programs and support and help in many different forms for the last several months with our community partner. But more importantly, we have become a source for right information. We all know there is a significant amount of misinformation, which is also impacting the COVID infection and its spread. Community engagement by nature creates that avenue of connection with the community better than any other domains. So we have been extremely busy, but this is in the time of COVID-19, so we like to continue to work and continue the work of community engagement. Some of you know community engagement at the MCW quite a bit. Some of you may be new. So I'd like to take this opportunity to give you a very brief outline of community engagement, especially its milestones. Community engagement in the medical college is little more than 10 years old. as a mission. But in this short few years, we made a significant stride and made us national leader in community engagement. Not only nationally, we are also known internationally. And there's a few milestones for you to think about. One is in 2008, Medical College decided to have fourth mission as a full mission, community engagement along with education, research, and clinical care. We are still one of the less than 10% of the medical school has a full mission of community engagement or even a part of a mission. In 2015, we established the annual MCW President's Community Engagement Award. This was also first, recognizing the exemplary work in community engagement, not only by faculty and staff, but by student and community partners. Since its inception in 2015, we have awarded 37 individual and organization to date. In 2014, we established the annual community engagement survey. And we do it alternate year with the faculty and staff. We have a huge database really now to know what is the benchmark we started with. In 2 years, last 2 years, 1,700 MCW faculty and staff has participated in more than 5,000 community engagement activities with over 650 community partners. Some of you who have been here longer, less than 20 years ago, it was only a handful of faculty and staff had any relationship with community or community engaged program. So from there to what number I just described is a significant change, and that is a positive change. Just to let you know, we are also establishing the first community engagement dashboard in any medical school in the country, which will be launched later this year. It will help to really assess community engagement from every department, every faculty. It will be more live, and people will be also able to connect with each other. It could be a collaborative format. The people knows who is doing what, but all of those will be updated through a process. So that will be unveiled later this year. In 2015, Medical College of Wisconsin received the Carnegie classification for community engagement, which is the highest honor or designation in the community engagement field, recognized both nationally and internationally. And we are one of the only 4 medical schools to receive that honor. In 2015, we also established Community Engagement Core within the Office of Community Engagement. In 2005, we received the Association of American Medical Colleges Community Engagement Award. In 2017, we received the Association of American Medical Colleges Spencer Foreman Award as one of the top 3 finalists. So far, we are the only medical school has been on the top 3 twice nationally. So since its inception, the Office of Community Engagement, under the leadership of Associate Provost and Senior Associate Dean, has been instrumental in providing support, mentoring, consultation to departments, center, institutes, and programs across medical college. But it also has helped changing the capacity of community engagement for our community partners. Our office is very proud of many community engaged work that happens across the MCW campuses. Here, also in the Green Bay and the Central campuses, and also in the Wisconsin communities. We provide the expertise and commitment to practice. Now, I'd like to bring something personal. Some of you already know, some of you may not know, that in end of February, I'm going to retire as the Associate Provost and Senior Associate Dean after 20 years of service at the Medical College of Wisconsin. It has been a great honor and privilege for me to do that. When I came in, there's not too much community engagement. When I'm leaving, we are in a very different place. What I appreciate most, that all through the pandemic, racism, other challenges we are going through, community engaged faculty, staff, student, all have been really engaged in authentic and meaningful relationships with community partners. Ultimately, the impact has to be in the community, not in the academic institution. Positive impact, successful impact happens in the community level. We have created that trust, and the trust makes us unique in making the relationship. So I like to, at the end, thank everyone, the participants, presenters who are all here. But mostly I like to take this opportunity to thank some of the folks, community engaged faculty and staff, who has been instrumental in moving community engagement at the medical college. They're the next leaders. And I have a strong belief they will take it to the next and higher level than where I left it. I'm going to now ask Christine to move forward. Thank you.
Thank you, Dr. Ahmed. At this point, we are ready to move to our breakout rooms.